Hi, good morning Hermath. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 16th of January 2024. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Hermath.
All right Hermath, could you please confirm your candidate number?
Yes. My candidate number is 43233342238.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Tell me about a time when you had to handle a difficult patient.
In a previous role, I encountered a challenging patient who was anxious and uncooperative. I first took the time to listen to their concerns, empathizing with their fears. I then explained the treatment plan in simple terms, ensuring they understood. I involved their family for support, and collaborated with the healthcare team to provide the best care possible. This approach helped build trust, and the patient's cooperation improved.
How would you prioritize and coordinate a complex patient?
I would start by assessing the patient's overall condition and identifying any urgent issues. I would then communicate with all specialists involved to create a cohesive care plan. Prioritization would depend on the severity and urgency of each condition. Effective communication, collaboration, and regular reassessment would be key to ensuring the patient receives the best care.
How do you ensure that you provide patient-centered care?
Patient-centered care is essential. I always take the time to get to know my patients, asking about their preferences, cultural backgrounds, and individual needs. I respect their choices and involve them in their care decisions. By doing so, I can tailor the care plan to their preferences and ensure they are comfortable with their treatment.
Can you provide an example of a time when you had to work as part of a healthcare team to achieve a common goal?
Certainly. In my previous position, we had a complex case that required collaboration among nurses, doctors, and support staff. I actively contributed to team meetings, shared insights, and offered assistance when needed. By working together and utilizing each team member's strengths, we successfully managed the patient's condition and achieved our shared goal of delivering quality care.
How do you handle conflicts with colleagues or superiors in a professional setting?
Conflict resolution is crucial in healthcare. When conflicts arise, I strive to address them calmly and professionally. I prefer open communication, so I would approach the person involved and listen to their perspective. I express my own concerns and seek a mutually beneficial solution. If the conflict persists, I'm willing to involve a supervisor or mediator to find a resolution that prioritizes patient care and team harmony.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Hi Mihiraa, good morning. It's lovely to see you again. I'm Hermath, your attending nurse here today. Could you please confirm the reason for your visit today?
Yes, I am here for the follow-up appointment today.
Perfect. Thank you for your confirmation. Well, Mihiraa, how have you been feeling since your last appointment?
My leg has been giving me some trouble lately, and I wanted to see how it's healing. The pain has definitely improved, but the redness seems a bit about the same.
That's good to hear, Mihiraa. Have you been adhering to treatment?
Yes, I've been doing my best to follow what the doctor told me. I've been trying to get plenty of rest, but keeping it clean is a bit tough. It's tricky, because it's hard not to accidentally bump it. I've been taking antibiotics like the doctor said, but I'm wondering if I still need to keep taking them.
I completely understand where you're coming from. It's essential to keep in mind that finishing the whole set of antibiotics is really important. This helps stop any chance of the infection coming back, and makes sure you heal up the right way. Even if you start feeling better, continuing with the antibiotics helps to get rid of all the bacteria, making your recovery quicker, and boosting your overall health. Your commitment to the full course is a key part of making sure you stay on the path to a strong and speedy recovery.
Oh, I see. I wasn't sure if it was necessary, since the pain had lessened. By the way, how much longer do you think it'll take for the wound to heal completely?
Mihiraa, your question is really important, and I appreciate you asking. It's a bit tricky to give an exact time, because how quickly someone heals can depend on different factors like the person and how serious the wound is. But if you take good care of yourself and follow the suggestions we've given, you should start noticing a significant improvement in the next 1 to 2 weeks. Well, do you have any other questions or concerns?
No, thank you for explaining everything so clearly.
You're welcome, Mihiraa. Now, let me explain to you the next steps in your care plan. We will begin with a thorough assessment of the wound, taking into consideration its size, depth, and overall condition. We will then administer appropriate dressing to facilitate optimal healing and protect against infections. To further enhance your healing process, continue the course of antibiotics that have been prescribed. Your well-being is of utmost importance, and we will provide you with detailed aftercare instructions to promote a smooth recovery at home. Additionally, we have scheduled a follow-up appointment for you in 2 days to closely monitor your progress, address any concerns you may have, and make any necessary adjustments to your care plan. Please know that you are not alone in this journey, and we are here to support you every step of the way.
Good to hear that, nurse. I'm grateful.
Mihiraa, remember to keep the dressing dry and avoid strenuous activities until your next appointment. If you experience any increased pain, redness, or fever, please don't hesitate to call the clinic immediately.
Definitely, I will.
Perfect. Now, Mihiraa, let's get your legs dressed up again. Can I have your consent to begin your wound dressing?
Of course. I consent to you.
Thank you for your consent, Mihiraa. Now, before concluding, let me summarize what we have discussed so far. Since your last appointment, you've been experiencing some trouble with your leg, although the pain has improved. You've been adhering to the treatment and taking antibiotics as prescribed, but you're unsure if you still need to continue them. I explained the importance of completing the full course to prevent the infection from returning. You inquired about the time it will take for the wound to heal completely, and I mentioned it can vary, but should show significant improvement in the next 1 to 2 weeks with proper care. You don't have any further questions or concerns, and you appreciate the clear explanations. Then, I explained the next steps in your care plan. We'll assess the wound thoroughly, apply appropriate dressings, and continue the antibiotics for optimal healing. Aftercare instructions will be provided, and we will schedule a follow-up appointment in 2 days to monitor your progress. You expressed gratitude for the information, and I assured you of our continuous support. Remember to keep the dressing dry, avoid strenuous activities, and contact the clinic immediately if you experience increased pain, redness, or fever before the next appointment. I hope everything is clear to you.
Yes, it is.
All right, Mihiraa. I wish you a speedy recovery.
All right. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.